A concept that you need to be aware of before you go into labour is the cascade of interventions. The cascade of interventions refers to a series of medical procedures during labour that can lead to more interventions, often unintentionally. While these interventions are sometimes necessary, they can sometimes increase the likelihood of complications, leading to more medical interventions, and the cycle continues. Understanding how this cascade of interventions happens and knowing ways to avoid or minimise it can help you have a smoother, more natural labour. So let's go through the common cascade of interventions that tends to happen during labour. So you might start out with having your labour induced with Pitocin or other drugs. What this means is that your labour is artificially started, often with drugs that stimulate contractions. Now, the impact of this is that those induced contractions can be more intense and painful, leading to the need for more pain relief options like an epidural. So you get an epidural to manage the more intense pain. And then when you have an epidural, pain relief is delivered through your lower spine, numbing your lower body. Now, while effective for pain relief, epidurals can then slow down your labour, making it harder for you to feel when to push. This can then lead to a need for further interventions like assisted delivery with forceps or vacuum. During the assisted delivery, instruments are then used to help guide your baby out when labour slows down or if you are struggling with pushing. So this can increase the risk of tears or the need for an episiotomy. So that's a surgical cut to widen the vaginal opening. If your labour slows down at any point, if there are fetal distress signals or complications arrive, a surgical delivery or caesarean section may then be needed. While sometimes life-saving, C-sections carry a longer recovery time and higher risks of infection or other complications compared to a vaginal birth. So let's go through some ways to avoid or minimise the cascade of interventions. So the first is to educate yourself and learn about labour and delivery. Understanding the process and all your options is going to help you make informed choices and feel more confident in your decisions. Take a childbirth education class or learn a few different childbirth methods. Classes, specifically those that emphasise natural birthing techniques, can teach you ways to manage pain and stay calm during labour without immediately having to turn to those medical interventions. Use your natural pain management techniques such as your breathing techniques and having an active labour, so including lots of movement and position changes. This can help manage pain and it can keep your labour progressing naturally. Also make sure you use massage and hydrotherapy, so warm baths or showers and massages can ease tension and reduce the need for stronger pain relief methods. Consider using a midwife or a doula. So a midwife often focuses on minimising interventions and supporting natural childbirth, while a doula provides continuous emotional and physical support during labour. And this can help you stay calm and in control, reducing the need for medical interventions. Aim to have an active labour and to stay mobile during labour. So doing lots of walking, changing positions, staying upright can help your labour progress naturally. Lying on your back, however, can slow labour down and lead to a need for more interventions. So staying mobile is the key. Try and delay or avoid labour induction if possible. So wait for labour to begin naturally unless there is a medical reason to induce. Allowing your baby to start labour on its own reduces the chance of needing stronger interventions later. Create your birth plan and outline your preferences for a natural birth, including when and how you want medical interventions to be used. While flexibility is important, having a clear plan can guide your medical team in supporting your goals. Stay hydrated and nourished and make sure you eat light snacks and drink fluids during labour to keep your energy up and help your labour progress naturally, reducing the need for interventions. And finally, choose your birth environment carefully. Some birthing environments, for example hospitals, may have a higher rate of interventions. Consider birthing centres or home births with skilled midwives if you want to avoid excessive medicalisation of your labour experience. While interventions, of course, can be necessary for the safety of you and your baby, understanding this cascade of interventions and learning how to minimise them can lead to a more empowered and positive birthing experience. Educating yourself, having supportive care, and trusting your body's ability to birth naturally can help you avoid unnecessary procedures and maintain more control over your labour.